Welcome back, everybody, to another exciting edition of Edpuzzle Notes on the reproductive system. We are going to start out with a test done on females called a pap smear. It is also called I'm just going to have to try and sound that out. Papanicolaou smear. Is that how you pronounce it? Maybe. I don't know. Anyways, so this is a test which is going to collect some cells deep inside the vagina right at the opening of the uterus called the cervix. So your gynecologist is going to use this instrument right there. No, that's not a duck. It's called a speculum. It's inserted into the vagina. They use these little cranks, because even though it is not a tube, like right here, it looks like a tube. Once that instrument is taken out, it will close back up. I mean, it's very stretchy. You know, a baby can go through there. But you gotta open it up. The gynecologist, the doctor, will scrub the opening or right around the cervix with a cotton swab. He or she will then put it on a slide. Look at those cells under a microscope, and going to be looking for any type of abnormality in the cells. So I'm not a doctor. I know the abnormal cells, they have a darker color, and that's one thing they look for. And this test is 90% reliable. Usually you're looking for cervical cancer when you're doing this evaluation in the doctor's office. Now 90%, you're saying, oh man, that's not 100%. But cervical cancer is a very slow developing cancer. So even if it's not, if you're one of the 10% that it didn't work, if you have regular pap smears, it will eventually show up in one of your pap smears and you'll be able to get treatment for it. And most of the time it's not cancer, even if they are abnormalities. It's, there's sometimes you can have a yeast infection or HPV, human papillomavirus, or something like that, which can lead to cancer. But anyways, that is a diagnostic tool to check, usually for cervical cancer. And here's kind of what a pap smear would look like. So the doctor here is taking a sample, scraping some cells from the opening of the cervix, which leads into the uterus, and he or she will then put it on a slide to check for abnormal cells. And obviously, that right there would definitely look abnormal. You don't even need a microscope to detect that. Now, one thing, you can never see your own cervix, no matter if you have a mirror or not. So this is something that you'll never be in the correct position to try so you don't try to give yourself a pap smear. Basically, leave that to the experts. All right, this slide will be pretty easy. The vagina. 4-inch long fibromuscular tube from the external body to the cervix, which is once again the boundary between the vagina and the uterus. This, of course, serves as a passageway for childbirth, menstrual flow, and, of course, intercourse if you are trying to have a baby. Now, the vaginal layers. The innermost layer is a mucosal layer made of stratified. Remember, that means has several layers, so it's not just one layer. It's several layers stacked on top of each other of squamous epithelium or squamous epithelium, however you like to pronounce it. I say squamous. Also made of areolar connective tissue, the most common type, and is folded into rugae, kind of like in the stomach. Its main function is it stores large amounts of glycogen. Remember, that was the molecule that's used as an energy storage in animal cells. That glycogen gets broken down to produce lactic acid. And since lactic acid is, of course, an acid, that makes the inside or the environment within the vagina very acidic. And that is, well, not very acidic, but relatively acidic. And that is harmful to both bacteria and also sperm, but more importantly, it helps protect you from getting certain types of infections. Now, moving out from the innermost mucosal layer, you have the muscularis layer, made of 2 layers of smooth muscle and also a layer of what's called adventitia. That is a fibrous layer which provides additional strength and also helps to bind it to the surrounding structures. Now, this muscularis layer is very important because it allows for a considerable amount of stretch, which is obviously very important, especially during childbirth. Unless you're having a really tiny kid, the vagina will have to stretch quite a bit. And the last little term here is called the hymen. That is a membrane that partially closes the orifice or the opening within the vagina. Probably most of us have heard of that. All right, a little bit more on the hymen. This over here would be what a normal hymen looks like. You can see the hymen down here at the bottom. There is the opening. That is normal because having an opening like that is normal. Now, some women, aren't even born with a hymen. That is somewhat normal as well. Now, this over here, called an imperforate hymen, would obviously not be normal. This is where the vaginal opening is totally covered by the hymen. And now once the girl reaches puberty and menstruation begins, obviously you need an opening. So that will have to be corrected by surgery. Same thing over here. This is called a microperforate hymen. It's not totally closed, but that opening is not going to do the job. Very small opening. That'll also have to be fixed with a actually very simple surgery. And this is called a septate hymen, which basically has a band of tissue right in the middle, so you have 2 small openings. Now on to vaginal discharge. These are obviously fluids released by glands in the cervix and the vagina. Range of color, it can be clear, milky white, or slightly yellow. Consistency, that's like, how thick it is or how viscous it is, changes based on the time of the month, the time of the cycle. It's more during ovulation, also during arousal. The main functions of this discharge is, first of all, lubrication. And any kind of lubricant is to avoid friction. So you don't want any friction in the vaginal walls. And also to make that acidic environment to kill bacteria, so you don't get a bacterial infection, and yeast, so you don't get a yeast infection. Now, some signs to see if it is abnormal, the discharge is abnormal. It could be strange colors, like not a slight yellow, but more yellow. It could be green. It could be chunky in consistency, or have a foul odor, or it could be itchy. Most of the time, these abnormal discharge are because you have either a yeast infection or a bacterial infection. All right, so glands in females. The greater vestibular gland, or the Bartholin's glands, located beside the vaginal opening and produce a fluid mucus secretion. The lesser vestibular or Skene's gland, first observed by the British anatomist Alexander Skene. It's located on the anterior, so that's the front wall of the vagina near lower urethra. The glands are surrounded with tissue that engorges with blood during arousal. So this is a type of secretion that occurs when the female is highly aroused or during the female orgasm. So this is not, well, I guess it could be a daily event, but it's not a regular daily event. Now these two right here, these are daily discharge, so you don't need to be aroused for those to occur, where this one you do. And the last one is the cervical mucus, released from glands near the cervix, provides daily lubrication, and the consistency, this changes during the female cycle. The consistency and the amount changes depending on what time of the month it is. Perineum. Hopefully you remember that term from way back in like August, maybe September. Now don't get this confused. This is not the peritoneum. Perineum. So it's right here, triangular area between the thighs in both sexes. Now sometimes during childbirth, what's called a episiotomy needs to be performed, and that is to accommodate, a child with a large head that cannot fit through. Now, and it's just a small incision. It could be a midline incision just like that, or it could be a mediolateral incision, which would go more like that. And now the vulva, which is the external female genitalia. First over here is the mons pubis, which is a fatty pad over the pubic symphysis, which is for it cushions, and that's going to be up here in that region right there. Then you have the labia majora, two longitudinal folds of skin from the pubis containing adipose, which is fat tissues, and sebaceous as well as sweat glands. And that can be found right out there. You have the labia minora, and this is found right in there. And it encircles what's called the vestibule, which is just the area that contains the external urethra and also the vaginal opening. Now the labia minora is composed of non-keratinized, stratified squamous epithelium, which is different than the rest of our skin and also different from the labia majora, because our regular skin in the labia majora is composed of keratinized, stratified squamous epithelium. So I went ahead and wrote that up here, non-keratinized. Remember, keratin is that protein within our skin, most of our skin, but the labia minora is non-keratinized, stratified. Remember, that means it's got several layers. And squamous or squamous are those cells that look kind of squashed. And finally, the clitoris. Small mass of erectile tissue covered by the prepuce of the labia minora. It enlarges during sexual stimulation, which could possibly lead to orgasm. And it is very similar to the male erection. Now, this is kind of crazy. It wasn't until the late 1990s. Now, you guys probably think, that was when, like, Abraham Lincoln was around or something. But 1990s, that was not long ago. That was when I was in high school. So back then, they thought that the clitoris was just, an external feature. But thanks to an MRI, they showed that it actually wraps all the way around the vagina and has most of it is actually internal. Very interesting. And also it has more than 8,000 nerve endings, which is twice that of the male penis. And now the G-spot, or the Grafenberg spot, named after Ernst Grafenberg, the German. I don't know if that's really how you say German names, but I think it is. So the G-spot. It is a spot within the vagina, the upper wall about a third of the way up, and anterior, so that means the front. It can be stimulated indirectly through the vaginal wall. So this would be a posterior view, so it wouldn't be this side, that's posterior. So it'll be from the front, so it'll be located right around there. So this is the front, this is the back. So this would be the anterior spot right there, called the G spot or the Grafenberg spot. And it's what's called an erogenous area. So it's supposed to be a spot that gives women intense pleasure. Many women feel an urge to urinate, but with empty bladders it is very pleasurable to some, not to all. Some experience orgasms different than frictional. Some feel nothing or find the stimulation irritating. So I guess it's a wide range. Some love it, some find it neutral, nothing, and some actually find it irritating. But there it is. It's the G spot located on the anterior wall of the vagina. And the mammary glands. These are exocrine glands in mammals, hence the term mammary, that produce milk to feed young for offspring. These are actually modified sudoriferous or sweat glands, which obviously produce milk, which is called lactation. The size of the breast is due to adipose tissue, which once again is fat within it. Of course, their function is to synthesize, which means to make, secrete, which means to release, and ejection of milk, which is called, once again, lactation. And it is stimulated by the hormone it says prolactin, but I'm fairly certain that hormone is called prolactin. I'm 95% certain it is called prolactin and not prolactin. I've never heard of a hormone like that. And the breasts are suspended by suspensory ligaments from deep fascia of the pectoral or chest muscles. Very simple slide. On the breast, you have, of course, nipples. These are the raised areas on the breast which allow milk to flow through, and just around the nipples is called the areolar or areola, which is the darkened area that surrounds the nipple. Very easy slide. I like slides like that. Breast cancer. Second leading cause of cancer deaths in the U.S. 1 in 8 women are affected. It's rarely before the age of 30. More common after what's called menopause. Menopause is, of course, the time when it's like marks the end of a woman's menstrual cycle, and that's later on, either late 40s and into your 50s. That's when menopause occurs. Only 5% of cases are younger women, and that's due to genetic mutations. Detection, you can detect from self-examination, so examining your own breasts, or mammography or a mammogram. If you feel a lump, you would have an ultrasound. You can see if that is if that lump is just filled with fluid, which could be a cyst, or if it's solid, which could possibly be a malignant tumor. Risk factors for any cancer, it's family history. That's the first thing you'll look at. I didn't know this, but no children. Radiation, that's always not good. Alcohol and smoking increases your risk. Now, treating breast cancer, depending on which type you have, you can have a lumpectomy, which basically cuts out the usually benign lump. You can have a radical mastectomy, which is removal of the entire breast, radiation therapy, and or even chemotherapy. And these next 2 slides are just for you to check your answers on your diagram that you have in your packet. If it is totally blank, well, I guess then you can fill it in now. If not, feel free to check it and change any answers you may have incorrect. And same thing for this slide. And this is going to be the end. This has been another great episode of Ed Puzzle Reproductive Notes. Thank you for listening, and I will see you next time.